I think, again, I've had so many patients come into my clinic, either on or wanting to start CBD. And I think there's issues around, number one, is that safe or not? What is the dose? Are there any regulatory aspects that we should be aware of in terms of CBD? How closely is it associated with medical marijuana, for example? Does one jump from the other? And I'm interested in the pharmacy, perspectives on this. Maybe, Chris, do you want to start us off on this discussion? CBD.
We don't sell CBD in where I am, but CBD, in order to treat sleep, is usually a pretty high dose. So you're talking about 160 milligrams in order for it to affect sleep. I think using CBD is actually helping the underlying conditions that help the patient sleep better. So if you're dealing with the stress and the pain and the anxiety, with the lower doses of CBD, you're probably going to get better sleep results because of that, not so much because it's actually helping the sleep.
Mm-hmm. I'm curious, do any of the prescribers in this panel use or advise CBD to their patients?
Yes, so I do. We're starting to use it a lot more for pain conditions as well as migraine. There's a kind of set of guidelines that I have for CBD. You want to make sure, typically what I prescribe are the oils, and patients can either rub it on their temples and the back of their head, kind of tender points when they have a migraine, or sometimes they'll put it in a little bit of tea or coffee and use it that way. I try to make sure to tell patients to use something that is a really good trusted brand, because you don't want to have the THC component in with your CBD. And the other important part is to make sure that the CBD is in a very good carrier oil, because that makes a difference in terms of breaking down the CBD. So you want to, the one that I like to recommend is MCT oil. Mm-hmm. But yeah, now that it's legal in a lot of states, we're starting to get a lot more evidence behind it. So yeah, a lot of times patients will bring it up to me, because they're starting to look into that if they've had migraines for a very long time and have tried a lot of different medications. And I think in terms of sleep, yeah, I think that's right. It helps with their pain. It helps with a little bit of their anxiety. So that helps just in general with them for their sleep as well.
Sure. Yeah.
Can I ask a quick question, to the pharmacists on the panel? How regulated are formulations of CBD by the FDA?
That's a good question. I really don't know. We only carry one particular brand. It's a brand that comes out of Kentucky. It's called Anata Pharmaceuticals, and it's probably one of the first ones that was available to the pharmacists, and it's been slowly picking up. More and more patients have been using it, and I find that patients seem to get some relief from these products because they come back for it. A lot of them use it for, a lot of the patients we have that are using it for focusing. They feel that they're able to focus with better using this product, and in doing so, they say they have a more restful sleep and they feel better throughout the day. But the regulation, I really can't tell you. I don't know.
Yeah, so to my knowledge, they are not regulated, at least not to the level of scrutiny of prescription medications, even over-the-counter medications. The FDA's primary priority is drug safety, even more than efficacy. So they do collect, safety reports. So any patient or even healthcare provider can report any safety issue, even for something like CBD, to the FDA. And of course, if they notice a trend or they amass, certain retrospective data, they can certainly, issue a type of warning or regulation, more so reactively, I would say. But at this time, there is not a lot of regulation. I think this is something that is controversial, and you could even there may even be emerging policy groups that may influence how CBDs are being treated, but I'm really curious to see how this will take shape.
Right. Related to this, what about medical marijuana? Is that something, it's interesting in Minnesota, there was this short period of time where they actually had an advisory saying that medical marijuana could be prescribed for obstructive sleep apnea, believe it or not. And this was from our state medical board. And all of us sleep physicians said, hey, wait a minute, there's really no evidence that this works. And there was, ultimately the AASM published a pretty strong statement about, look, there's just not enough evidence for medical marijuana, because we were getting patients coming to our office after the Minnesota State Board announced this, and they had to sort of track back. But what about medical marijuana for things like insomnia and chronic pain? Is this something, again, I bet Dr. Sheikh has more of a perspective on this than most of us, but anybody comfortable with medical marijuana? What should we be doing there?
Yeah, I'm outside of CBD, medical marijuana itself, I certainly have a lot of patients ask me, and I have a lot of patients who are using it either on their own or do have a card. But there's just not enough evidence for me to be comfortable myself prescribing it in terms of migraine itself. So I do I ask patients to find someone who is able to prescribe it. And I know you have to, get a certification or do certain steps in order to be able to prescribe it, which I haven't done myself. But I think it's going to be something that we're going to have to become familiar with, because it is something that patients are seeking out themselves. But yeah, I don't necessarily guide patients towards that way, because right now we don't really have any evidence or studies for migraine. And we do have so many other new medications that have come out for migraine. We have so many other kind of things in our toolbox that it's not something I go to, but I think it's important in terms of having the information available when our patients ask us about it.
Sure. I'm curious, and maybe Dr. Vanderveken doesn't know this, it's a little bit outside the scope of your practice, but is there medical marijuana in Europe taking on at all? I don't know if Dr. Vanderveken's still on our panel. Maybe he had to leave for a surgery, but I was just curious, because I think Europe and the United States have pretty different approaches to marijuana. So I was just curious about that.
So the idea of THC being helpful in OSA was actually a study with dronabinol, which was actually positive. Right. It's a small reduction. I mean, it's like anything else. So maybe you could throw it in the armamentarium, but the problem is it's still the Wild West. It's really, we need like a Goodman and Gilman of THC and CBD. I mean, there's so many potentially different forms of this it's crazy. The only sleep data that I know of was actually a neurology article that looked at short-term and long-term. The short-term effects were actually very positive for sleep, but the long-term effects of THC was actually not positive. But it really needs to be formally studied, and like I was intimating, it needs to be studied in terms of specific, different formulations, because there seems to be some. It is amazing how convinced some patients are about CBD and THC, but
right, I agree. Excellent.